Hi, everyone. Welcome to What's New with HRIF, our last data training for the year. Yay, welcome. You made it through. Of course, before we get started into this fabulous presentation, there are some logistics that I need to kind of go over. All attendees are muted upon entry. Please use the Q&A function, and we will do our best to answer your questions during the presentation and time at the end for more discussion. We welcome your feedback and recommendations for improving future webinars. The slide and recordings will be available after the webinar. This will be posted on our CPQCC website. If you are currently listening to this webinar in the conference room or in some other team format, please create a sign-in sheet and send it to contact mccpop@stanford.edu to be eligible for contact hours. Our contact hours are provided through the Mid-Coastal California Perinatal Outreach Program and has been approved for up to 1.5 contact hours. To be eligible for contact hours, please remain on the webinar the entire time and complete our post-webinar survey. The survey will be available immediately following this presentation. So today's presenters we have with us Dr. Susan Hintz, who is the HRIF Medical Director for CPQCC HRIF, and myself, Erica Gray, the Program Manager for CPQCC HRIF. In addition, I love to highlight our additional team members, Eileen Liu, who is our software engineer, and Tian Yao Liu, our biostatistician. Um, so to continue on with our continuum of care within CPQCC, which is unique, of course, to California, we are going to be focusing on the HRIF reporting system in our program. Quickly, just our agenda. We are fully packed as always, like we do every year. We will be going over some of the CPQCC program databases access, highlighting our QI project that we're currently working on, reviewing database reports and system improvements, reviewing the data finalization and awards for awards, and then of course for 2026. That process, highlighting our NICU referral dashboard, going over some of the current projects, and then we'll be ending with resources in a Q&A session. So without further ado, I will turn this over to Dr. Susan Hitz.
Hi, thanks. Thanks, Erica. Obviously, I had my screen on wrong. So we always like to start by reminding everybody sort of the history of the CCS High Risk Infant Follow-Up Program. And as many of you know, we're lucky to live in California, where as early as the late 1970s, our California Children's Services recognized the need for follow-up, and the state launched the NICU follow-up program. However, changes with the state, including how large the state had become, and the fact that many felt that we could do even better. The CCS reached out to us in about 2006 to the CPQCC to partner together to restructure and totally remodel high-risk infant follow-up. And the full launch of that remodeled high-risk infant follow-up was in 2010. And so many of you are well aware of the high-risk infant follow-up program letter, which provides a lot of additional information about diagnostic services and structure. So CPQCC by the numbers is shown here, and we can see that there truly is a great continuum of care from almost 400,000 births a year in the CMQCC to NICU and all NICU database through the CPETS transport program and to high-risk infant follow-up. And we currently receive about 9,000 referrals per year. So here in the next slide, again, this is from directly from the CCS numbered letter that outlines the eligibility. And as you all know, all small babies, birth weight less than or equal to 1,500 grams or less than 32 weeks are eligible for high-risk infant follow-up. And then there are many areas of medical eligibility for bigger babies that include neurologic, cardiovascular risk factors, and many other medical eligibility factors. In the next slide here, we see the NICU referral requirements, and we always like to highlight this because each CCS approved NICU must have an organized high-risk infant follow-up program or a written agreement with another CCS approved HRIF program. And it is the responsibility of the discharging to home CCS NICU or hospital, or the last CCS NICU or hospital providing care, to make that referral to high-risk infant follow-up. Shown here is the NICU referral process that includes information about the high-risk infant follow-up reporting system as well as the service authorization request. But again, this information can be further found in the HRIF program letter. We love to, reiterate that, again, California is really fortunate here because not only do we have what is traditionally sort of a 2-year visit, but our California Children's Services have provided for 3 standard or core visits, starting with 4 to 8 months, 12 to 16 months, and sometime between 18 to 36 months. But additional visits are covered by CCS as determined, needed, and advocated for by the HRIF team. We, as you know, in our HRIF visits go beyond neurodevelopment to really understand the service needs and the family issues that may be going on. So we collect information about hospitalization, surgeries, and medications, services, as I mentioned, not only what they are receiving, but what you as an HRIF team are needing to refer them to at that visit. And that really underscores the value of HRIF. We also collect information about state services like Early Start and Medical Therapy Unit, and importantly, about parent concerns. Again, we want to just highlight the HRIF reporting requirements, that the HRIF coordinators responsible for ensuring that the data is collected and reported to the Systems of Care Division, CCS HRIF program, and CPQCC. And you can see here sort of the list of the HRIF program coordinator obligations that are listed here. And again, you can see that on the CCS HRIF website as well. So now I'm going to turn this over back to I almost said Dr. Erica Gray, to Erica Gray, who is our wonderful program manager.
Thank you, Susan. So just to kind of go over the requirements for access, of course, this is just outlining some of the information that you need to provide to us via a help desk ticket. So of course, your hospital has to be a CCS approved NICU or of course approved HRIF program, and you must be listed on our member directory. If you are not listed on the member directory, you just have to have someone who is an authorized user must be included on that request when you send in your ticket requesting access. There is also a way for you to access the system from home or off-site if you're not within your hospital setting. The requirement here is that you're going to have to contact your IT team, and they're going to have to install a virtual private network. This is a portal that would enable you to be able to access your network as if you were on site. Of course, your email address, your phone number, and your user account access. Here is where you are identifying what type of access you need. So there are many, many layers to secure our system. One thing that we always like to point out is that this system is not just for HRIF program clinics. It is also for NICU leaders and teams. They can utilize this database to make referrals for their eligible HRIF patients. They can also track and manage those patient referrals, as well as view NICU summary reports, which Susan will go over later on in our presentation. Here is just a screenshot of where you can access our HRIF reporting system off of our cpqcc.org public website. So if you click at the top under the login, you click on the HRIF, it will then direct you straight to our portal, I guess you can say. I just kind of highlighted here that in case you have not accessed the site in a while, there is a feature there where you can submit a ticket to us, or if you forgot your password, you can go through the process to resetting your own password instead of having to create a help desk ticket to me to assist with that. So this is just a high level of who and what all the CCS, NICUs, and HRIF programs within the state of California. There are 123 NICUs. Of those 123 NICUs, 67 of them have HRIF program clinics. And from those 67, 12 of them actually have satellite clinics, which means they actually travel to another location nearby their primary location to also conduct clinic assessments and visits. By the numbers for the referrals and visits, thanks to all of you up until this month, October of 2025, almost 136,000 patients have been identified, registered, and referred into our database. So congratulations to all of that hard work of identifying those patients and making sure that they are being referred and followed. In addition to that, we always like to identify that only 63% of those patients are VLBWs. And then, as well as the number of standard visits performed, around almost 200, well, 201,000 have been conducted, performed standard visits, as well as in addition to the 13,000 additional visits performed. Now, looking over the years for our referral rates, as you can see, when we launched in 2010, we were roughly at that 7,000 mark. But then with QI improvement and identifying and really streamlining which patients should be identified and bridging those gaps, we got that referral rate up to about 9,000 a year starting in 2019. And we basically been around that, averaging about 9,000 every year after that. Just pointing out here for 2025, registrations for those babies born this year will actually close June 1st of 26. Now, just to kind of highlight some program notifications. So Children's Hospital Orange County, also known as CHOC, has now merged with Rady Children's. So you will notice a name change in the system. So their name change is now Rady Children's Health, Orange County. We also put the parenthesis of CHOC in there just so people can continue to remember that that is CHOC indeed. And then unfortunately, as of September 30th, Community Regional Medical Center closed. So all of their babies from that will be referred to Valley Children's Hospital. I just want to make a plug here that in any case, if there are any hospital name changes or email changes, to please submit a help desk ticket to us so that we can make those changes within our system, as well as if there are any site closures or temporary closures, due to facility, moves or construction. Please make sure to contact our the CCS state partners at DHCS, as well, in addition to contacting us so that we can help you with that transition period. So I'm turning this back over to Dr. Susan Hitz.
Thanks, Erica. So we also like to highlight just some other things that are going on because we want to share with you all the numbers and all of the nitty gritty, but we also want to share with you, quality improvement activity that you are helping in, and you definitely have been helping on this one. In terms of you probably all recall that, or many of you who were around during the beginning of COVID, that we worked with all of you, and we actually worked with a team from across the state to really quickly bring together some expertise around telehealth related and telehealth evidence-based assessments. And what we found was that all of you quickly evolved your approach to assure patients received care during the COVID pandemic. As I mentioned, we quickly developed and implemented telehealth guidance, which all of you then implemented at your sites. We provided expanded assessment options that were evidence-based. And when we asked all of you in serial surveys from your team perspective, what are the concerns about telehealth? What's working? What's not working? We heard very loud and clear that there were some really well-founded concerns about telehealth use in the setting of HRIF, as well as some barriers at your institution. But nonetheless, as I mentioned, the vast majority, or the majority of you did implement at least some of your work by telehealth during the early periods of HRIF and this of COVID. And this is just from April 2020 to that through that 12-month period. And as you could see at the beginning, there was quite a few sites that were doing a number of their uh, up to 60, 70, 80, even all of their visits by telehealth. But there was substantial heterogeneity across regions, and this is just showing you by regions. There were also by site quite a few differences, and there were both regional factors, there were demographic factors, and there were site factors that potentially were reflective of challenges, but also around whether the best care could really be provided by telehealth. So that led us to really ask the question, along with all of you, what's going on around telehealth in the post-pandemic era? And I think we all know that our group here, including all of you across the state who are invested in HRIF, it offers a unique possibility for us to get some information about longitudinal changes, especially in the HRIF setting in telehealth. So as many of you know, we had launched what were quantitative surveys for all of you, but also asked coordinators and medical directors if you would also be involved or be willing to be involved in a qualitative interview, which has been ongoing. And we really wanted to know the barriers, the successes, and also get some quantitative information. Part of the reason that we wanted to do this is because, as many of you know, the California Department of Public Health that supports and deploys issues around Title V really has highlighted a priority need for access to quality care and services. And of course, as we are all thinking, are there some situations where we can help families access services for HRIF? Of course, we want to find out what may be working or what might not work at all for telehealth. So one of the first things that we wanted to look at was around what's been happening in a more granular fashion. And this is thankfully our expert biostatistician, Tianyao Liu, who will be talking later, put this 3D graph together that is showing actually every single high-risk infant follow-up clinic. And so what you're seeing is every one of those lines that you're seeing in the front is showing that they never did any telehealth visits during that period from April 2020 to September 2020. And those ones in the back that kind of have higher or lower peaks, that's showing you over time the number of telehealth visits those sites did. So again, this is showing you in even more granular fashion that there's quite a bit of heterogeneity across the state. And then this is showing you on a longer term phase, all the way through July 2025 by California region. And again, we didn't show you here by site because that would just be too difficult to see. But this is the percentage of high-risk infant follow-up standard visits that are performed by telehealth by region. And so you can see there's still one region, that's the one in purple, that is still, by all of the sites in that region are doing somewhere between 20 and 40% of their visits by telehealth. But the other regions are really doing less, and some are doing basically none by telehealth. So to try to get further into that to explanation, as I mentioned, we designed a survey, a quantitative survey that was mostly multiple choice that was deployed to you as coordinators and medical directors, designed to take just a few minutes to ask about the status of your telehealth at your clinic, components, those currently using telehealth, which visit components you used, if you were implementing it, et cetera, and an interest in the interview. And I want to just highlight both Erica Gray and Tianyao Liu, as well as Ellie Colan, who is shown here on the right, who is one of our amazing postdoctoral students who's got a huge amount of experience in qualitative research. So the next slide basically is giving you an overview of where we are with that. The survey was closed in early October. These are very high level responses that about 30% are using telehealth in some way, but the majority cited concerns about the quality of the visit by telehealth. And Ellie is going to have a lot more detailed information from her work and the analysis of Tianyao Liu that we'll share with you in a future meeting. But just suffice to say that there is a lot of rich information that you guys have all provided about this. And I think, again, California is going to be head and shoulders above the rest of the United States in terms of our ability to share that information. So I'm going to pass it back over to Erica Gray at this point.
Actually, Susan, this is you.
Oh, this is me again. Okay, so sorry.
No, no, it's okay.
So, yeah, just wanted to talk about database reports. You're right. This is mine. And we are also going to show some things that may be helpful for you to share with your NICU colleagues or even to share amongst yourselves. So this is actually the HRIF reports web page. And you actually don't really even need to have to get access to your site in order to explore this, especially the 1 minute sample app summary. I think is a really great opportunity for you to explore options for the many data reports that exist. Because we really do have just a lot of rich information available for you. So in the next slide, this is going to be something that is all very familiar to you. This is you have already entered your location, your site. And if you click on high risk infant follow-up report, you will all see the many options that you have to filter down for yourselves, but also in combination with speaking with your teams and also possibly the NICU team. So you're going to be able to see your site or all California. You're going to be able to filter by discharged NICU as well. You will also be able to filter by birth year, remembering, of course, that remembering in the back of your head which birth years are closed and which are open. You'll also be able to filter by birth weight or gestational age, or actually put in a custom birth weight range or a custom gestational age range. You will be able to filter by qualifying medical condition, or you could just look at all. And then finally, you're going to see the the kinds of visit that you might want to target. So let's say you want to just look at patients that got there at the first year, et cetera. But I think then really the vast number of reports that we have that will allow you to drill down directly on what you, your team, or the NICU team or other teams that you're talking about may want to look at. And again, I think, I keep mentioning the NICU teams because we really feel that meeting with your NICU teams and sharing your HRIF information can really spark further collaboration and interest from the NICU team into the outcomes that are not just Bailey scores, but all sorts of outcomes beyond the NICU doors. And we really are hoping to invigorate that collaboration because we want the NICU teams to really start talking about HRIF to start with and to really integrate you in that planning. So these are just a few of the reports that you can see. This is, for instance, one particular site where we're looking at the first visit at patients that are less than 28 weeks. And this was a custom birth year range. I'm not going to tell you what it was, but this is just looking at follow-up status and disposition. And so you can see that there are a number of things. If you take the next step, that you can click out for pop-up windows if you want to get the HRIF number for the seen cases or those that did not, that closed cases or did not come but were expected, so you can get further information there. And then I wanted to show you the follow-up status. So this particular site is doing a great job. They have 92.7% follow-up rate. So 152 out of the total registered of 164. And then you can look a little bit to the right there, and you can see that is the total follow-up rate for this same filtered group for the whole state of California. Then you could look all the way over there. You can see the lower and upper quartiles, and you can see it kind of represented in this little cartoon. And you can see this particular site, the red dot is the site, is doing better than most of the sites in California. So in the next slide, this is just a different HRIF clinic, and this is a different part of the report. And this is showing you, for instance, we like to kind of show you things about how you might be able to use this information to explain perhaps to your institution, hey, we really are needing more resources. So this is one site where they are using 39% of their visits at this time are requiring an interpreter. And when you compare it to all the rest of HRIF clinics, you can see that this site is really, needing their interpreters, and they're really high level interpreter use. So this would be an example of something you could take to your institution or whoever you talk with in terms of your managerial structure. This is really out of the ordinary for most of California, and we really need your help in securing resources for our clinic. And part of this also may be due to the fact that this particular clinic has an incredibly high rate of public insurance. And so this is another kind of area that you could point to in your institution about why the other resources might be needed. I'm just giving a high level example, for instance, of another report that you might be able to share with your NICU team that will show you, for instance, the number of children who are receiving medical services or being referred for medical services. This particular site, at their first visit, almost 75% of them are requiring are either receiving or requiring referral to medical services. And you can see here that's about what's expected. But you can further drill down to see that, okay, about 69% are using or being referred to 1 to 2 services. But what that means for this site is that more than 30% of their patients who visited are requiring 3 or more services. So this gives you an overview of these medical services. And this furthermore gives you kind of information about what are the top medical services used and also comparing it to others. And then if you look at the next slide, you can also, again, something that often the NICU teams might be interested in integrating into thinking about talking about early is hospitalizations and surgeries. And this is just showing you this particular site, almost 19% of those patients have had another hospitalization since their NICU discharge. So this is at the first visit. And you can see that this site is actually a bit higher than the highest quartile for the other sites in California. You can also see the reasons for the hospitalizations in these reports. And I think overlaying this, we show some information about surgery. If you click forward, and the same thing, you can see that that about 14% or a little bit more of this particular site required a surgery between the time of NICU discharge and the first visit. And you can similarly see the reasons for those rehospitalizations for surgery. Now, there may be overlap. This doesn't necessarily add up to 100% because some children are going to require more than one surgery. And I think that's another important point to make. Okay, so we also, again, I keep talking about the NICU because we want to also give the opportunity to the NICU team to understand the importance of high-risk infant follow-up in a lot of different ways. So there is a separate NICU summary report. And what is that? That is basically exactly the same kind of information that we have available to us in the HRIF report. It is, however, through the lens of the NICU. So it is basically, instead of looking at the patients in the HRIF clinic, it is looking at patients who have come through that particular NICU. So they can see this information through the filter of their NICU. They can filter by inborn and outborn, but it is basically exactly the same information that is presented as the HRIF reports. So we want to just highlight again, and you're going to hear this again later on, that we really feel that NICU team leaders really can, based on this report, and they really should gain access to the NICU summary reports, and they should actually be jointly working with you as HRIF teams to think about how information can be presented. So please remind your NICU colleagues they can submit a help ticket, and we will help to get them connected with that report. I also just want to highlight this other report that maybe, Erica and I thought maybe isn't utilized all that frequently. It's the clinic activity report. And again, we really feel like this is another important report that you can look at your by month, over years, period. So you're going to be able to see registrations, referrals, each of the visits and additional visits. And this really gives you an idea of changing volumes, possibly increasing volumes. And this, if you go forward, Erica, you can see that you can filter by years. You will be able to see your own HRIF program here. And you can actually use this data also to be able to present to your administration, to your institution, to help advocate for showing kind of the changes that are going on. And especially if you have increasing patient volume with decreasing resources, I think it's a very valuable way to look at this. And finally, we just want to highlight again that the CCS annual report, which of course all of you participate in, your medical directors sign off on, is a way for you to look at a range of like the entire birth year over the course of a longitudinal period. So you can see up here, if you advance there, Erica, you can see all of the sections that are there are roughly aligning with the reports. And then if you advance again, Erica, you can see that you can again review the reports and filter them by birth year and by various gestational age and qualifying medical condition. Okay, so I think now I'm turning it back over to you, right,
Yes,
Eric?
you are. Thank you. So what I would like to do is really just highlight the system improvements that we launched this year that some of you may have noticed and some of you may not even have known that it has happened. So one of the things that we've done is patient search. So there are new search fields there that you guys should all see. There's this, you can search by gestational age, birth weight, or infant sex. There's also a new column view option. So when you first log in, you can look at certain items are available to you. If you click on that column icon, you can then turn on other or decrease the amount of items that you want to see as far as columns. One other new addition that we did, which actually came out probably last month, was now it displays transferred out cases. So if you have kids that you transferred out to another HRIF program and you're searching for them in the system, now it'll let you know, like, no, that kid you transferred out and this is where that kid is now receiving their follow-up care. Of course, the NICU referral dashboard, which we launched this summer, I will be kind of highlighting that later on in my presentation. If you haven't taken a look at that dashboard. Case transfer and pending cases now has a drop down where you can export those tables. If you ever need to use them for internal site use, that was actually launched last month as well. Um, Number 4 is the autosave standard visit. So I know you guys are all aware that sometimes if the system kicks you out or you get booted out or something magical happens, with our Wi-Fi connections, you could sometimes lose the data that you were working on. So specifically for the standard visit form, if you are working on that and that situation happens, when you re-log in, you're going to get a box that's going to appear to you and say, do you want to continue working on that form? So that way the system is actually saving the standard visit every minute. So in case anything, a disaster happens, you don't lose the data that you are working on. And then last but not least, in March earlier this year, we launched the clinic feedback. This is a way for us to kind of get real-time feedback from you all, expressing, what type of improvements you feel that the system may need, or sharing any, data, like if there's a data report or something specific that you're looking for that you're unable to obtain or find in our current reports. You can actually provide that feedback in there for us as well. And then, of course, if your site is using our system for any specific QI projects, we would like to know, and kind of hear from you what you're doing and how that feature is helping you. So with the removal, as you guys all know, of the PHI data items from the referral registration form, we created an HRIF patient log for sites to keep track of their patients. So this log includes the columns for HRF ID, the MRNs, patient names, first and last names, of course, and as well as the CPQCC NICU record ID number. This log is available on our HRIF data resources page in 2 different versions. There's an Excel version, and then there's a Word doc version. Just want to point out that this is intended for internal use. So therefore, there is no need to submit. We're not asking you to use this and submit this to CPQCC or HRIF. It's only for your internal purposes. So now on this slide, I want to show and kind of just re-highlight the electronic data submission, or EDS, feature that we have available for you for your referral registration forms. So under the user icon, if you click on the EDS upload, you're going to actually you come to this page where it allows you to identify the file. So the EDS file that you want to upload into the reporting system. So on our HRIF data resources webpage, there is the list of the EDS instructions. So it takes you through everything that you need to format your EDS file so that it could be properly accepted and uploaded into our system and read properly. There is a skeleton file that will also show you how you should have your data displayed. And of course, I am the person who would work with you and your team to test it out and to make sure that everything is aligned and working appropriately, so that you can, on a monthly or quarterly basis, extract data files using your EDS and then upload those into our reporting system. And so right now, this feature is only available for the referral registration form, but there is talks and hopes of making this available for the standard visit form. It's just that that's going to take a little bit more work to make sure that we can make that happen for you all. So of course, once you have your file ready to go and you have tested that out with me, once you upload it, you will get a table that kind of looks similar to this. The system kind of runs through some checks for you. So of course, it will outline any issues. So if this is a possible duplicate record, it will highlight that for you. And then you have actionable items that you can either remove that duplicate, or you can review that case record just to verify, to make sure, no, it isn't a duplicate, it's actually a new patient. So then you would just click the yellow, you'll click the submit button to make sure that the file is uploaded. If there is no issues, of course, the submit button will automatically check yellow or check off for you. And then all you have to do is hit the submit record. Once you hit submit record, it's going to then give you this green box that's going to indicate all of the HRF ID numbers that have been assigned to those accepted records. And then under the pending cases, so there will be a new table available to you titled EDS records uploaded within the last 6 months. So that will list all of the patients that you just uploaded. So if you wanted to recall who all those kids were, that will be listed there for you. In addition, you'll be able to export that file so that you can take that, export that data out, and then those HRF ID numbers you can incorporate into your patient log. So that way you have all of that information all in one place. Another feature that I'm sure you guys all see every time that you log into the system is the announcements. Here is where I try to provide you all with most up-to-date information. Rather, it's a pop-up workshop that I'm getting ready to do, new resources that are available, like our new events that we may be hosting or having a partnership event. I try to put that information there so that you guys have that readily available. Other things that I will be posting in this area will be if there's any system improvements, any program updates or data finalization, like the deliverables and the deadlines, to try to keep you guys on track of that information, as well as any QI surveys. So this would be like the annual evaluations, or like we did the telehealth survey, for instance, that was listed in here as well. And then reminders are always going to be listed here. So those may change or maybe stay static depending on what those reminders are. And then of course, this is where you will also let us know, get to that other screen to kind of tell us what's going on and what we can do to kind of improve the system. So now to talk about data finalization. So I want to just summarize the year. So I want to say a huge, huge thank you to all of you for all of the hard work that you guys have always continued to do. This is wonderful. I love seeing 90 or 85 or anything above 80, anything over a B, we're doing great. So I just wanted to point out, we had 95% completion for items 1 and 2, 100% for item number 3, that's your 2023 referral registration forms. And then moving on to item number 4, we're at 92% for submissions for those first visits for 2023. 85% for both item 5 and item 6. So that's confirming the CCS report for birth year 2021. And then, of course, registering and closing we're registering your 2024 infants. And then item number 7, we have it at 98%. So we were almost there for you all updating your directory and getting those, meeting those deadlines. So now the awards. So congratulations again to all of you and all the hard work that you guys continue to show and do for this HRF reporting system, and of course, overall for our babies and our families. 60. So 89% of you of the centers all received at least one award, with 14 of you actually being granted all 3 awards. So we had 54 Superstar Award winners, 18 follow-up rate winners, and then last but not least, we had 47 Crown winners. So this next slide is just to show you where those awards live. So on our Member Data Awards webpage, you can see both of NICU and HRIF awards are listed here. If you click actually on the View Award Certificate, it will take you to a page that looks like this. So you'll have your 2025, and then it'll list all the winners for 2025. And if you need to obtain or get a copy of your certificate, you'll just click on View Award Certificate and you'll find yours and post it and share with your team. So again, congratulations to everyone who was awarded the 60 programs that received an award for 2025. So now I'm going to take you through the 2026 data finalization. So again, here is our schedule. I like to highlight the preview of the CCS annual report. So this comes out April 1st. This is probably the third year or second year I think we've actually made this available. So this gives you an opportunity to kind of look at that end year report before you have to sign off on it. So in case you need to make any modifications to any data that maybe is missing or wasn't submitted properly, you can make those changes. And this April 1st report will update on a nightly basis to reflect those changes that you make. But overall, our schedule is highlighting the different deadlines that we have: June 1st, June 17th, and July 1st, and what deliverables are required to meet those deadlines. And then, of course, the awards, which are highlighted in orange here, when those awards actually come out and what you have to do to be able to be granted and receive those awards. So the closeout checklist, which I'll go over kind of quickly, kind of just highlight a little bit here what is due. So items 1 through 4, those are all due on June 1st. These are system checked. So as the system checks every night, once you meet that deliverable, the system will check that box off for you. If you complete items 1 through 4 by May 1st, so a month early, then you'll be awarded the Superstar Award. Item number 5 is our signing off on the CCS report for the closing birth year of 2022. That deadline is June 17th. That final frozen report is made available on June 2nd. So you have almost a couple of weeks to review that report and sign off on it. And then items 6 and 7 are the last two data items that are due on July 1st. Of course, if you complete all of the items by the deadline, your program will be awarded the Crown Award. So just to kind of go over item number 5, confirming the report. Once that report is available on June 2nd, you actually go into that report, you will select who you are, you will check the box, and you will confirm the report. That date will then be saved on your closeout checklist. This is just, again, a high-level view of what the CCS annual report looks like. Item number 6, this is where you're going to be registering all of the babies born in 2025. This is the only one that is a manual check. So you actually have to check this off in the closeout checklist. So once you have reviewed your data, reviewed your NICU logs, and you've identified all of the babies for birth year 2025, you will then come into this closeout checklist and you will check this off. Just want to point out that this checkbox will be made available January 1 of the closeout year. So for example, January 1 of 2026, you'll be able to check this off if, of course, all of those kids have been identified and registered in the system. If you do not have access to the CPQCC HRIF NICU match report, all you need to do is submit a help ticket to me. I will then grant you access to that. And if at that time you want to review that tool, we can also do that at the same time, so that can orientate you to how to utilize that report so it can benefit you during this time of closeout. And then item number 7, here is where you're going to be updating the directory. I'm just going to kind of show you how to get to that directory. So if you click on the user icon, click on update directory, this is what you will see on your end. You will make the changes to the form. It is very important that at the very bottom of the form, where it says last updated by, must have a value. So we are asking you to put in your first and your last name. So basically just override the existing individual, or it could have been you that did it again, and you just make sure that there is a name there and you're going to submit it. I do want to point out that I am the one who reviews your directory, and then I look at the completion date. If the date is prior to 26, so 2026, it will not be completed. So I am recommending you all, once January comes around next year or February, that's when you can go in and you can sign off, and that way you can already have this completed early on in the year instead of waiting for July 1. It's also highly recommended, of course, that you review and update this directory every 6 months or whenever changes occur, as many member hospitals, NICUs, and HRIF clinics rely on this directory, especially for patients that move across the state. So here on available on our public-facing data resources webpage, you can find the full calendar 2026 NICU and HRIF. So you can see if you're one of the lucky ones who have to do close out for the NICU side as well as the HRIF side. We provide you with one calendar to kind of showcase all of those deadlines and those award dates. There's also process guidelines available to you. I have a one-pager quick reference sheet that you can print out just so you can reference really quickly. And then again, you get the schedule that you can also reference. So next, I just want to kind of highlight our NICU referral dashboard. So if you have not looked at this or you were just like, okay, I don't know what this is, please take a look at this report. This is a new dashboard that we built so that the NICU referral team can have a landing page so they can kind of see and track and manage their referrals. So it's kind of similar to to the clinic action dashboard, where you're going to have some notice boxes across the top. And so their notice boxes that are visible here are current registrations and current referrals and registrations. Viewing details here actually opens up a pie chart so they can see where their kids are being followed for receiving their follow-up care, what sites they are, and the numbers and the percentage. Then there's two actionable items that's here, that's pending referrals or declined referrals. So this view details will actually open up the pending referral pending cases so they can actually see, okay, which kids are pending referrals, like maybe they were missing some information or they want to do follow-up to make sure that those kids were supposed to be referred to the appropriate location. And then, of course, if there are declined referrals, there is an opportunity for them to review those declined referrals. And then if they were not, like they didn't meet eligibility, then they should be removed out of the system. And then there's also the last gray box, which is the timely referral registration. So this allows you to look at yourself. So looking at your site is going to be in the teal, and then there's a gray chart, gray line in the back that's indicating by all NICUs. So you're able to see what is your timely referrals for by birth year. So you can see just kind of from this example, we're looking at 69% follow-up rate. Well, I'm sorry, I didn't mean to say follow rate. Timeliness is about 69% for their birth year 2025. And then if you're looking at the next chart, the way that we're looking at referral registration timeliness ranges by year, where you're kind of comparing yourself to, of course, all NICUs, and then looking at by day, how long is it taking for your site to make those referrals? And so you can see just quickly, there's for 2025, you can see there's a huge improvement that this site has actually done as far as getting those kids referred in a timely fashion. You can actually click and you can see like their upper quartile course is about 94 days. So they have about a few patients that were probably after that 60-day, which is the dotted orange, the dotted line that goes across that's that recommendation that we say about 60 days. So of course, any kids that are over that 60-day will be considered non-timely. But you can kind of just get a glance of how how each site is doing compared, by year, and then compared to all the sites within with all NICUs within the state. There's also another chart for referral status by month. Here's where you can see how many of your referrals are pending, how many are accepted, how many have been declined or declined and deleted. When you click or hover over that, you can actually click and you'll get a full list of those patients that have been accepted. So in case there were some declined referrals and you wanted to know who those declined referrals are, if you clicked on that bar, it will at least highlight and show you that information. And then last but not least, there is the standard visit number one for the follow-up rates. So here you are able to see by year the total of referral registrations, which are in the gray bar. And then you have different, how many of those patients that were seen for that year are actually displayed in the teal. Those that were none not expected to be seen are in the red, and then so forth. If you clicked on like seen cases for birth year 2023, you kind of get some more granular data to see your true total expected of like 144, which means the first seen visits 61%. So your true follow-up rate for those kids that were from your NICU that were expected to be seen for their first visit, their follow-up rate is about 61%. So now we're going to go into our QI projects that are currently in progress. And so we have our ROCKS group, which is the Resources and Opportunities in Clinics. This consists of 9 HRF coordinators from across the state representing different hospital networks and regions. This group's first project was the series of surveys, which all of you participated in. The purpose of course, these series of surveys was to collect information that can be used to develop standardized processes for CCS HRIF programs across the state. So Tien Yao Liu, our biostatistician right now, will now review the results from the first survey that focused on clinic operations.
Okay. Hi, so I will share some information we learned from this survey. This was the first ROC survey focusing on clinic operation. It was completed in November 2024. And from the survey, we learned that 68% of responses were made by nurse specialists and registered nurse. This is really a crucial information for us because it provides us direction when handling future survey analysis. On a recent telehealth survey you all have participated, this information is what we use to filter data, especially when multiple responses were given from the same clinic. And from this ROC survey, we learned that 40% of HRF coordinators are performing multitasks, right? Their responsibilities are shared. And then we see on the pie chart, it's showing how your HRF visit was organized. 83% of you would have multiple providers on the same day of the standard visit, and 11% will have individual provider appointments separately. And we all know that each clinic is super busy and packed with appointments. And we learned that 2/3 of HRF centers follow not only CCS HRF eligible patient, but also non-CCS HRF eligible patients. So for the next slides, we're showing you about the percent FTE distribution by CCS level. So each bar represents the count of HRF centers with the same CCS level and the same reported percent FTE. For example, if we look at the first bar on the left, we see there are 3 centers reported at 0% FTE and CCS level being community. And from this spread out information, we really want to see how overall as HRF clinics, their FTE were distributed, right? We learned that more than half of the clinics, right, 35 out of 64 indicated that their HRF coordinator FTE is less than or equal to 50%. And those are highlighted in the orange boxes. However, with different CCS level, we learned that the FTE percentage were actually very different, and there are heterogeneity between them. 70% of community level, Erica, yes, thank you. So 70% of the community level clinics reported less than 50% FTE, while only 17% of regional centers reported less than 50% FTE. And the next slide, we will review in combination of your current caseload and your reported percent FTE. And this chart is analyzing those two together, right? So each bar now is representing the caseload from 2020 to 2023 for a particular center, sorted from low to high using the left-hand side y-axis. So it's the 0 to 100, 400, 600, etc. And then each red dot represents the reported percent FTE in the survey. So we're using the right-hand side y-axis. Those are highlighted in red. As a reference, right, a 50% FTE line was given for your comparison, right? So we can see, center number 6, number 14, and number 29 indicated 0% FTE, while the center 41 has the highest caseload over 1,200. However, the percent FTE was less than 30%, which could be alerting. And all of these centers are reported as the CCS level being community. So the next chart we're highlighting really the regional centers. And similarly, each bar represents the current caseload, and each dot is representing the reported percent FTE. And we see that most regional centers have relatively high percent FTEs, with only a few reported percent FTE being less than 50%. And the next chart is really evaluate the availability of different services or different providers among the HRIF clinics. And as we see clearly for the social workers, it's available through all the clinics. And for audiologists, it's less than 60% available. And for different providers, there are varies across all the centers. Okay, so I will give the stage back to Erica.
Thank you, Tianyao. So with all that said, and thank you all for providing all of that information, just want to point out that next month, please look out for survey number 2, which will focus on program support questions and about data collection and case management. We hope to receive responses from each program. So this is just a quick screenshot of what items, just kind of give you an idea of some of the questions that will be asked in that survey, but that survey will be launching out in probably early November. Okay, Susan.
Great, thanks, Erica. So we want to take you through some other things that are going on that you all have participated in or that you know about. And this is a project that's focused on early detection of high risk for cerebral palsy. That again is basically quality improvement. So next slide. Many of you are very well aware that a lot of international data has demonstrated that using standardized exams like the Hein and other risk factors and other types of assessments can identify high risk for cerebral palsy even in the first months. And many of the CPQCC HRIF teams, when we sent other surveys, when we've adjusted the standard visit forms to collect this information, have really expressed desire that they would like to have further information, further education, so that they could deploy this in their own clinics. And so to that end, CPQCC facilitated a series of half-day Hein trainings for interested HRIF sites. And so this was a Cerebral Palsy Foundation certified trainer who came out to your sites if you expressed interest. This wasn't a requirement of CCS, but we really wanted to serve the members' needs and serve the patients' needs as well. And so for those of you who have chosen to implement to implement Hein in your clinics, we also wanted to provide for you some resources to help with the implementation. These will still be coming out, and other information will. So we put together a work group again to really develop this information. And so what we've developed and was sent out to you was an overview document that really was like a PDF of a screen show that really showed you bit by bit, the information that we understand you need, and resource folders. So really you can access this information as seen in the last slide. You don't even need to sign on. You can just access it from the follow-up data resources, and you will find it here. And I think it's really important for you to see that you'll get the overview and you're going to get these folders of resources in each one. So if we just go to the next slide, again, the overview, just a high-level view of the overview is it is in 3 sections, as again, it's a PDF that is basically a slideshow that you can review with your team that has the background and evidence. It points to those resources that are in that resource folder. It has a section about CCS medical therapy program eligibility and tips around that, and it points to resources in another folder. And then finally, sort of deploying the Hein and tools that you might be able to use in your clinic. And so just showing you the next slide here is, again, just click through here. You'll see if you click there, you'll see the resources there. You'll just click the PDF, click on these other ones. You'll see a list actually for the key in for early detection CP and intervention resources. It's quite a long list that you can use for your own interest as well. So basically, again, we have sent this out. This isn't like brand new information, but the next slide will give you a little bit of a reminder of the email that was sent out. There was a MailChimp announcement sent out on October 10th. Kind of looks like what's on the screenshot on the right side. There was some information about the overview, presentation and resource documents. But again, we are very, very happy to talk to you about this. For those of you who went through the training, it can sometimes seem a little bit overwhelming to implement. But we are also very happy to hear from sites that maybe didn't get a chance to have training, because we are still very willing to help work with Dr. Dusing through the CPQCC to bring that training to your site. So please reach out to us if there are questions. We're really very happy to help and to help to motivate and organize. So another project that has just been launched that we are excited about, and we've had a lot of help from all of you through the last few months, is the Parent Voices Project. So why do we all want to do this project? Well, we know that very preterm infants face many challenges, and particularly their parents and families face many challenges. And there has been a historical approach when we do a project of kind of clinician focused, child focused, but really the parent perspectives and what they see as challenges and resilience factors along their entire journey through the NICU to HRIF has been sort of missing. So what we're really trying to do with this project is learn from parents and center their voices. So this is what is this? It's a mixed methods project. So this has been IRB approved, basically has been deemed to not be human subjects research, because we're not gathering a lot of detailed information or identifiers. Parents of children who are born very preterm would be offered the opportunity to participate in a survey, which is just basically a short QR code scanned survey either around the time of NICU discharge or any of the HRIF visits. This is not longitudinal. It's not the same patient that's getting referred out or parents. It is all at once. Parents also have the option to get a gift card. They just need to give us some contact information for that only, and then it is removed. But they also have the option to tell us if they want to have a longer interview, which is the qualitative part of this. And then we would get information to be able to contact them, but it would be a confidential interview. You see here, there's gift card options for both of those. So it is, again, 5 to 10 minute survey. This is created to be as easy for sites as possible, which you'll see in one of the pages next. And our goal is for about 100 to 150, both pre-NICU discharge and at the time of the HRIF visit. So you see here on the next slide, just a page that shows you, we send these to you. The family just scans that QR code, answers a few questions. Really what we need from sites is to kind of socialize your groups to do this if you want to participate, and to find a way to share this flyer and hand out with the parents. Really, we are not asking you to collect any data. We just are hoping that you will be able to help facilitate this so that we can all learn from parent voices. So again, we hope to eventually, not only through centering family voice, parent voices here, but then to take that further to kind of educate NICUs and HRIF about what we've learned, about what works and what doesn't work, and really hopefully have site-specific and broader improvement, and ultimately use this information to develop something with all of you and with NICUs that could really move toward a transition from NICU to home program or project. Okay, so I guess I am going to hand this over to Erica Gray for next steps.
So next for resources and support. And so I will kind of skim through this so we can allow for time for open discussion and questions. So this is just really highlighting all the different reporting system tools that we have available to you to help you, submit your data, track your patients, manage the information, clean up everything, make sure that you're meeting all of the deliverables, like in the closeout checklist. So these tools are there to help you. We also have an online manual that's embedded in there. So if there's any time that you need to understand what is being showcased to you, what's defined as what, every single definition, description is all listed in the online manual. That's clickable from the navigation, or you can actually click on actual notice, like information. If you hover over certain data items, if you get a question mark or it highlights, if you click on that, it will also open up the manual for you. Again, we have our data resources webpage that lists pretty much everything on the CPQCC facing site. So of course, what I had talked about, the data finalization, that's where you will find the details about what's due and how to make that happen. We have a family handout that's available to you. There's the guidance and telehealth visits document that Susan had highlighted early on in the presentation. And then, of course, the HIND and early detection of cerebral palsy, which we launched last month. If there are ever any questions specifically about CCS or SARS authorizations or any county issues or whole child model, those should all be directed to California Department of Healthcare and Services, DHS, at using their HRIF at dhcs.ca.gov email portal. Please, you can always email me or submit a help ticket, and I will request if it's a question that I cannot address or we cannot address on our team, I will send it over to DHCS on your behalf as well. Next, so If you need any more assistance, remember there is the help ticket. So you can always submit a help ticket. I just want to point out that those help tickets come to me. So I will be addressing those questions for you, just as long as when you select on the type, you select HRIF database, those will all come funneled to me. There's also another way that you can reach the help desk is by, if you're in the reporting system, there is the help desk little widget down at the bottom. There you can type in, there are some articles to kind of help you with probably answer some of the questions that you may have. If they do not answer the questions, you can always submit a ticket through that feature as well. And then last but not least, I will be doing some more pop-up workshops. Some of you have actually attended a couple that I had last month, but I will be doing a data finalization process and closeout checklist on January 15th. So that is in the announcement page where you can register for that. And then I will also be standing up a couple of more pop-up workshops specifically around, of course, the NICU referral dashboard. And then Susan will be joining me to do some of the summary reports pop-ups as well early on in next year. So now, without further ado, we will turn it over and start opening up the floor for Q&A.
Thank you all. I did answer several of the Q&A, and I know a few of you had to pop off, but there is a question about the timing of the first visit. And I appreciate that. That is a topic we address actually in the overview document for the Hind, but if it's okay, I will just share. Oh, someone else is sharing.
Oh, I'll stop.
Okay. I will just share that one slide with you, which this is the very last slide of the PDF document. And this was this approach was sort of undertaken with the Hein expert, Dr. Stacy Dusing, as well as input from CCS. So for utilizing the Hein alone, early assessment obviously allows for if you were integrating that only in your HRIF without the GMA or the TIMP, and I would say, I think it's going to be there'll probably be only a few sites that will launch the TIMP because it really requires quite a bit of training. We would encourage the initial assessment in the early part of the standard visit 1 window. However, just to know that data does support predictive validity of the Hein at least through 12 months, so it could also be utilized later or in the window if that was necessary. So for sites using the Hein and the GMA, whether or not you're using the TIMP, for sure we know that due to the GMA age ranges, and some sites are using that because their NICUs are starting to use the GMA, then the HRIF teams are also integrating it. But because of the GMA age range limits, the initial high-risk infant follow-up visit would actually need to be done at less than 20 weeks, corrected for prematurity. So what the recommendation is that the initial visit, because it would really be kind of focused on that assessment, would most likely be an additional visit. So it would actually be an additional visit as the very first visit, just basically primarily for the GMA and Hein. The reason that this was recommended is that then the first standard visit would still be available to you so that you could have the full evaluation. And actually, it would be another evaluation if, let's say, your first additional visit evaluation with GMA and Hein was questionable or concerning, and you wanted to have a sooner follow-up anyway. So I know that's a long-winded answer, but but again, we really tried to make this document kind of pack in a lot of information that we thought would be of interest. I'll also say the other thing about the overview document is that we do have a lot of tips for tools about implementing the Hein. So not only do we sort of remind people about the pro forma for the Hein, but we also remind people that, if you're using Epic, there is an entire Epic community library that your IT team can help connect you with. So there's a lot of tools already in that community library that are like dot phrases that you might be able to use to just basically document in your clinic visits what the findings are, because I know that's sometimes a big pain. And there are lots of other, types of documents that are included in that as well.
Okay, so I see a question in there about the electronic data skeleton, well, the EDS submission for the referral registration form. The question is asking, they notice that there's some changes with the race and ethnicity fields on the registration page. Does the electronic data skeleton file reflect these changes? And the answer is yes. The skeleton file and also the documentation, the guidelines have been updated to reflect those the race and ethnicity changes for the birth year for 2025.
Those were great questions. There were some other questions. I think everybody can see the Q&A, but that we answered having to do with, a way to sort of see babies transferred into your HRIF that are not from your exactly connected NICU. And so my recommendation there was to use the filter for the NICU, referring NICU filter for the HRIF report. And I think that helps you to look at, this is exactly why that filter was placed, because there are some NICUs that you may be having more challenges with, things like getting timely referrals, or you may be connecting with a larger NICU that had previously maybe referred their patients elsewhere. So you may want to be able to, meet up with them, communicate with them about those findings as well, and also remind them that they could get their NICU summary report access to. Okay. Open. Okay.
Oh.
Can you review the reason trisomy 21 is not included in HRIF? That is a CCS, decision. And I believe the reason there is that there are other trisomy 21 resources. Having said that, I will say that there are patients who have trisomy 21, but also are eligible for HRIF based on the medical eligibility. So that would include patients who have a congenital heart disease that require intervention in the neonatal period, or infants who have trisomy 21 who are born within the gestational age range. Will CCS approve additional visits then before standard visit number 1? You need to, basically what we have been told is if there is documentation of why you need an additional visit, and in this case, you would say something like, for instance, for an early visit having to do with early CP detection, you would say, this patient is at increased risk due to infant risk factors, GMA in the NICU, GMA results in the NICU, or neurologic exams in the NICU, brain imaging, and therefore we will be doing the GMA and Hein, in a period of time in which we have to do it because the GMA is not able to be done or is not valid after 20 weeks corrected age. And do we have any indication if there will be updates from DHCS on the numbered letters? So in other words, you're asking, I think, whether there will be updates in general to the numbered letters. Again, this is a CCS that's a CCS decision. We have heard that they are reviewing all the numbered letters and that they are making so that they are making changes as they see needed. There will not, as I said, if this is specifically about the Hein, there is not a requirement from the CCS to utilize the Hein or the GMA. So we were very clear about that in this document, in the documentation that we showed. This is definitely something that we undertook on the CPQCC side because the HRIF teams, told us we want to use the Hein in our clinic. We want to receive further education. So we really took that on ourselves. This is not a requirement by CCS. In fact, on the standard visit, the standard visits, we're not collecting Hein data. We are asking if if early high risk for cerebral palsy was identified, and just basically a simple sort of multiple choice, what did you use to identify it? We have always had medical therapy program referrals as part of the information we collect. And of course, one of the things that, has been shown in other projects across the world has been that with earlier detection of high risk for cerebral palsy with appropriate referrals and further diagnostic assessment, that those children end up getting into services and getting interventions earlier. And so that's obviously something we want to help all of you to improve quality in that way. And so, of course, we will be looking at the information related to the timing of referrals from your data.
I think we have about 2 minutes left. So I don't know if there's any more questions.
So the follow-up to the question, I think, about the DHCS numbered letter, are we expecting any changes or updates to qualifying medical criteria? We actually haven't heard anything. So as I said, all we know is what we've been told by our state colleagues, that the CCS is reviewing numbered letters, but we don't know anything specifically about about our numbered letter, for instance, or whether there's specific criteria that are being questioned. So we can't answer that for CCS. Certainly, it's something that could be. We also have, and maybe Erica, we can highlight this too, that there is a direct question and answer sort of email bucket for CCS. So if there are specific concerns, I'm feeling like whoever asked these questions may have heard some rumblings that I haven't heard. So if there are specific questions about that, definitely you could also directly email a question to hrif@dhcs.ca.gov and ask them that question.
Okay. I think we're at time, but thank you all for attending today's webinar. We're going to wrap up with a few reminders before we let you go. Once you've logged off of the webinar, you should see a page with the survey link for today's event. But for your convenience, I've also put a QR code here on the screen. And I will very much look forward to your feedback. CEUs will be sent out at the end of at the end of this session, since this is the last session of our data trainings this year. And we'll be sharing all recordings and materials at the end of the session as well. So with a huge thank you to all of you in attendance. Thank you for participating in our 2025 annual data trainings.
Yeah. Now, there's one more question.
Oh,
Michelle, which survey are you talking about this Qualtrics survey? She would like that to be in the chat.
the-
Maybe in the Q&A, because I'm not sure they can see the chat. Yeah.
okay, I can't copy and paste that. Let
I'm
me,
not sure that I can copy and paste it either.
let
Hold
me,
on a
let
second.
me, I'll
Let's see
stop.
if I can try a different one. Hold
Let
on
me-
a second.
I'm grabbing it. I can help you.
Okay, thank you so
Just
much.
give me 30 seconds.
Okay, all right. It's going to be in there soon.
All right.
Okay.
That's the Qualtrics link. Thank you in advance for filling that out for us. We really appreciate it.
Okay, and I don't know that can they see Annalisa? I'm not sure they can see the chat.
Sorry about that. It's in the right chat format now. Thank
Okay,
you.
it's in the, okay, great. Hopefully, let's give a couple seconds for people to click on that before we close up. But thank you all for joining. And thank you, Erica, and thank you, Tian Yao, for such fantastic work.
Thank you.
And thank you all for your fantastic work in HRIF clinics. Really appreciate you.
Exactly.
Okay.
Should we keep this up for a while, or I don't know if people are using their QR? I don't know.
I believe when people exit out of the webinar, the
They'll
link
get
should
it.
also pop up. Yep.
Oh,
So we should be
perfect.
good.
Okay. All
Thank
right.
you.
Thank you.
Thank you all. Bye-bye.
Bye.